Welcome everybody. Thank you so much for joining us today for this webinar, An Introduction to the Aged Care System, which is obviously going to be a large webinar full of wonderful information. This is an educational suite of videos, interviews, conversations, and your experiences. So you have an opportunity here to have a voice and come in with your experiences of my aged care. We hope and aim to guide and assist you over the up and coming month or webinar series to find your way through my aged care. The information today is proudly brought to you by OPAN, which is the Older Persons Advocacy Network, and we acknowledge the great work undertaken by the Aged Care Navigators Trail, which was led by CODA. Funded through the Australian government, but amazing trial, and I'm sure we're going to get some great information and experiences from that. So this webinar is, looking at if you are an older person at home and finding it harder to do the things around the home that you used to be doing. Do you need some help around the house, or you have some more complex needs that require help and services and support to keep you at home? My Aged Care is where you're going to be coming to and finding the services. So my name's Marie Montgomery, and I would here today with Maria Berry, and I'd really love to introduce Maria. Maria's been an amazing assistance in this webinar series and research, and comes with a lot of experience, and we've had a lot of fun together as well. So I welcome you on board, Maria. Thank you so much for your time and expertise today.
Thanks, Marie. Thanks for having me.
It's a pleasure.
Huge honour, so thank you.
Yeah. So can you tell us a little bit about yourself and your background?
Sure. Marie, my experience has been well over 30 years now, with a professional nursing background, but also working within the community, advocating and working with older people. I've also been a health consumer representative for over 10 years.
Okay, that's a big role.
It is, but it's been so much fun having the opportunity to work with various organisations over Australia, and that includes organisations like CODA and Senior Rights on various projects in the Department of Health and Human Services, and that's where I hold my passions.
Yeah, and a lot of passion and a lot of experience. It's great. It's great to have you on board. All right, so the My Aged Care Journey board, which is going to come up on your screen now, is just really an introduction of what we're going to be covering. So today the webinar is Start the Conversation. And literally the two components, the first webinar that you registered for today and then the following one half an hour later, we're literally just having the conversation, because it's about being prepared, looking at finances, how, do I actually need aged care services, and where do I go? What do I do? How do I start? The next one we're going to be looking at in the webinar series to come is how to register with My Aged Care. And we'll go through step by step of how we do that. We look at the website today, we look at how you register, what sort of questions they're going to ask us, and what you need to have ready and prepared. Number 3, the series looking at an assessor who will come to your home. Now, we might have, I think, 6 or so webinars just on this particular point. It is starting to look at the different types of assessments, different types of services, different types of funding. So it's quite involved. Then we move on to eligible services, assessment by ACAT and RAS. Then finally, beginning your aged care services and what you should expect, waiting times, your ability to, complain if you need to, who you get assistance from, those sorts of things, and then finally reassessing your service requirements. So it is a great journey board. It's literally what we're going to be following throughout the webinar series. It also links quite well with the new website from the aged care, My Aged Care website that was launched yesterday. It came live and it's much improved. It's great. So they too align quite well. So today is an overview. It's a bit of a chat on what My Aged Care is and the importance of having that conversation. So I guess, Maria, in regards to your 30 years experience and I guess recently, in regards to your role, in My Aged Care, what are you finding? What are your dealings out there?
Sure. I guess the questions that are coming up has been the difficulty for people to try and navigate the system. And the first thing is that the message I'd like to say today, you can't plan early enough.
Okay.
Yeah. I've received, I think after Narrabri, Marie, we were up in Narrabri on the weekend for the wellness gathering.
Great gathering. Thanks, Narrabri.
Thanks, Narrabri. And the feedback from some of the older community members was really quite powerful. Questions arose that they had reached crisis point. They didn't know where to go to seek help. There was also the sense of pride. I have a daughter, but she has a family and she's too busy.
Okay.
There was, it's just too hard. I can't find my way because I'm unwell, my husband's unwell, I want help now. So it's the conversations around the pre-planning that is just so vital. And it's also talking to your family, your GP. You may have a GP that you have a wonderful relationship with. He might be the only person that you have in your life that you trust.
Mm-hmm.
So opening up those conversations about how you start and where you go. You also might have a friend, a lifelong friend, that knows all about you and what you want, that might be the person that you can have that conversation with. It doesn't always have to be the husband or the daughter. Mm-hmm. It could be someone that you trust and knows you well. So, but it's really important that we all think, oh, it's not going to happen to me, I'm going to be okay, and there'll be a percentage it won't happen to. But I know myself in my 50s, I've had a few incidents that have happened that have really scared me, and I thought, I need to do some more planning myself. It's crucial.
Absolutely, and I think that's one of the key messages that we're going to get across today is that starting that conversation early with all family members, and I guess being aware and acknowledging that there'll be a service that is required at some stage.
Yes.
And also if the daughters, sons are involved, and then they're on the page as well. Great, and you're right, recent events across Australia, we've found that there are many hurdles and that people find themselves in crisis before they actually access services, and that includes advocacy services as well.
Absolutely, Maureen. Another thing too I should mention is that not everybody is computer literate.
Yep.
Some people living in rural, remote areas have issues with
Yep.
internet and so forth. So it's looking at the other ways you can obtain the information that you need and do the homework.
Good. So to viewers out there, I'm not texting a hot date that I'm having later on tonight. I'm actually getting some texts about you guys. Now, I believe you can't hear Maria. So,
speak up a little bit.
Yeah, that'd be great, darling. Okay. Thank you so much.
Not a problem.
Whilst I'm on that, and I've got my IT guru here, Tom, who's going to hate me for doing this, but I'm jumping forward a little. We've got Q&A today, so that really helps us. Up in the right-hand corner, obviously some people have found that, is a chat button. We can take live questions. We may not be able to answer them in great detail today. Sometimes we can take it back, get more information from the gurus behind this other door over here. However, we want your experiences, and that's what's driving us today. The key message is have the conversation about what is aged care, what does it mean to you, what does it look like, how does it fit, and also looking at your experiences navigating My Aged Care. And I know there's a lot out there, so tell us what you found so that we can look into it a bit more. Okay, so let's also look at other ways you can share this story whilst we're on that. So there is, should we go to the OPAN page, Tom, and have a little look at the OPAN? Yep. Now there's an OPAN Facebook group which share experiences and tips of the trade and all those sorts of bits and pieces. So if you go up there, Tom's showing us here into the guests list, is it? Yes, and then across into that Facebook group. And you can share there with other people your experiences. Do you need help navigating aged care? There's some wonderful tips, and we can share the beauty of technology when it works. All right. Okay. So Q&A, Facebook, we've done that. Let's move on. Let's actually have a conversation. So the conversation is absolutely pivotal that everyone starts looking at what my aged care means. And I guess we drove back with advocates and educators from Narrabri yesterday, and I think one of the important things was start that personal reflection on what do you want in your aged care. Yeah, so I know for myself that it will be staying at home as long as I can and getting services in, and I'm sure majority of Australians out there are the same. So look, I guess, Maria, where do you start having this conversation? What are some of the topics? I mean, we recently talked about washing machines.
We did. And I hope everyone can hear me now. If you can't, please text in. Thank you.
So we were talking about washing machines and how everyone's bought a washing machine, and when you go out to buy one, you're either going to get top loader or front loader, you need 5 or 8 kilos, special suds, disposals and all sorts of things. But when you go and get aged care services, what are some of the topics that you need to find, or some of the components that you need to explore or get information? Because there's a lot of information out there. It's just trying to find it, isn't it? So what are some of those topics that we need to discuss? Let's really draw those out.
And look, some of the topics that we need to discuss, as I said, pre-planning is just so important. We hope nothing does happen, but if it does, we need to have that plan in place, and that you're already part of the system, that you're in that system.
Yep.
Some of the key questions that have come up with conversations have been around financial, has been a really big one. You need to look at where you are with your financial position, whether it be you're on a pension or you have assets.
So what do you mean financial? Do you mean, everyone on a pension then needs to get reassessed?
I think everybody...
Before you even use the pension?
Yeah, I think under any circumstance, somebody needs to... You need to have a financial plan.
Okay.
In preparedness. Because if you're receiving services, a lot of this is going to come back on your current situation. Do you have assets? Are you on a pension? Do you need to do a financial assessment? So that's a key. Also, you can utilise services like through the Department of Human Services.
Okay. Yeah.
OPAN, you've got advocacy there as well.
Okay. Good.
My Aged Care is where you start, where you begin to seek that information.
Okay.
Now, if you're in a situation you think, oh, this is too hard, I just can't do this on my own, you need to look at having a power of authority or a representative to help you with that.
Mm-hmm.
And this is something that will come out with the webinars that are coming forward. But planning homework, looking at the area that you live in, perhaps what services are available, what choices you have.
Yeah, absolutely, yeah. So what about financial with Centrelink? Is that a good access site?
Yes, definitely. You need to bring all the key parties on board, but Centrelink's certainly where you do go. And it takes time, so that's hence the pre-planning.
Okay, great. So you said homework and pre-planning, and I think that's absolutely pivotal. So what we're going to do, the new My Aged Care website, live yesterday, we're going to go over to there and we're going to go and do a practical. So I'm now just turning 65. I might have had a session in hospital where I now need to have some services at home. Okay, so I would go to good old Google, and I would type in my aged care. Okay, just like that. Now, comes up, just be aware sometimes there are advertisements for providers that will assist you in my aged care navigation. It's up to you, but what we're looking for is the governmental site, .gov. Yeah, so we're going to click into that. Thanks, Tom. And you'll see my aged care. Now, it's really easy to navigate this one. If you scroll, you can see the toggle boxes at the top. There's home, types of care, whatever. And if you scroll, as my lovely Tom's doing now, you'll see learn about the different types of care. You can click into that. And we're going to follow this with our webinars as well. So you can click in, learn about different types of care, get assessed. There's also finding a provider, and that means in your area. So, across Australia, there's many different providers, and they provide many different services. So this is a great website. As you saw, it's easy to get to. Those that don't have internet service, and we dropped out a couple of times around Narrabri and the Warrumbungles yesterday. And also, if you need to use the phone number, the number, which is just now escaping me, aren't I naughty? The department, oh no, that's the finances one. Oh, we are live. Here it is. Okay, 1-800-200-422. I'm going to say that again. 1-800-200-422 for the My Aged Care assistance by phone. Now, there is also an interpreter service as well. Now, before we go any further, I've actually got one here from Ray. And thank you, Ray. It's actually a really, really good question. I'm a volunteer with the Aged Care Navigator program. The main issue is finding people who need help. And Ray, I hear you. A lot of people out there are probably requiring services at home, alone. We did hear of some stories yesterday going around the elderly people within the group, and some of them were horrific, stories that they just weren't aware that they could have services. Isolated, quiet, didn't want to bother anyone. So, Ray, that's a really, really good question, and I think that one needs to be investigated a bit more.
I think, Ray, that's a very big key issue is social isolation. There are people out there that could use support and help and access to services, but they are isolated. And I guess through these webinars and through other webinars and work being done around advocacy and even within our own communities, that communities are actually getting involved and stepping up in providing support for older people in their areas, in that things like Neighbourhood Watch is a program that's been bandied around and talked about, what you can do within your communities to check on the older neighbour. I'm very passionate about the farming area, when farmers are out on their tractors in a paddock miles and miles away and they're not seen for days. How can we keep an eye on that? And I think it's having these conversations, creating the awareness and providing all that information for education. So, but it is a big one, Ray.
Yeah, thanks for that, Ray. And you're right. We've got to get out there and figure out a way to promote the services and get more people in. So let's go back to still having that conversation, because this is all about being prepared, and you're really new to My Aged Care, and we've shown you the My Aged Care website and how you can get onto that, given you the phone number. So what other conversations can you have, or are there other groups that might be able to assist? And I'll just say sorry, darling. I know you're so beautiful and gentle, but they can't hear you when you
still can't hear me. Oh, okay. I'll look ahead. I do apologise.
That's all right. I'm loud. She's soft.
That's all right. I hope you can hear me now, and I do apologise.
That's okay. Other groups.
Yeah. Other groups, well, there are lots of other groups. I mean, OPAN, your advocacy networks are really crucial. Senior Rights, CODA, depending on the state that you're in.
Yeah.
But yes, there are other groups, and you might find that there are groups within your community as well that you need
Okay.
to approach. Yeah.
So what sort of community groups?
Yeah, look, our councils are doing a lot of work
Yeah.
around age-friendly communities and social isolation, and I know I've just increased your workload. Some of the councils
All these
out there.
webinars are going to.
Yes, but you are very much a resource. You can also go through Gateway Health services like that in your state. You might have a community nurse. You might have a neighbourhood watch house that you could call it, just have that conversation with your GP, counselling service, all sorts of people. But we just need to open up those conversations, and then you'll get the direction will flow. If they can't help you, they're going to help you and direct you to somebody else.
Absolutely, absolutely good. So yes, it's talking to services, or I guess agencies that can assist you.
Absolutely.
So again, some of those are OPAN. It's opan.net.au. No, it's not. It's opan.com. And the national number is 1-800-700-600. And their services available across Australia. Each state has their own advocacy service, like ERA in Victoria, ADICAS, and Seniors' Rights Service here in New South Wales. Other little conversations that you could have to start talking about and start exploring and looking at what sort of areas or topics do you think? Would fees be a good one to start looking into?
Oh, absolutely. Fees is always a big one that comes up for anybody. How much is this going to cost me? On the My Aged Care website, there is, I believe, I have had a quick look. It was only launched yesterday, but there is a fees navigation guide there that can give you some of that information. You can also, again, if you're not able to access a computer or do that, you might have someone that can do that for you, step it through like an advocate. And you can also ring My Aged Care. Don't be afraid to pick up that phone.
Yeah, excellent. So we've got some Q&A coming in hard and fast, so thanks guys. Oh gosh, it's really buzzing up here. So look, Ray, I like Ray. Ray's got some good advice here. Is it now feasible to have remote emergency medical alert that can be carried by farmers and truckers?
Oh, I think that's a brilliant idea. It's going to be, Ray, about encouraging them for the reasons for actually having those and wearing them. But this is certainly, any ideas like this is just fabulous, and this is what we want. Bring them in.
And that comes with having conversation. It comes with looking at the pride, I guess, as well, and acknowledging, okay, maybe I need to have something along this line. Now, there's a great one here from Sally. People don't know what they don't know. They have no idea of what they can access. We totally get that. That's why we're here.
Absolutely.
And the more we can get out there with conversation, and CWA ladies we're having a chat to, Lions, Rotary, Men's Shed, just to have the conversation. It's the same with what we've been talking about with elder abuse as well. As soon as you start having that conversation, we start to demystify and we provide links. So thank you very much for that one, Sally. And if you can help us, let them know what they don't know, so that we can provide education. That's what this is about. Stacey, what is being done to address outreach gaps? More services need to provide this vital link. Stacey, I hear you loud and clear. Both of us are regional. We get that. We're big voices for remote and regional. I do a bit of remote nursing still as well. So what we're trying to do in regards to that is look at innovative ways that we can get these services out there. We're also aware that NBN goes down and hotspots.
Absolutely, and staffing too. Having services out there in those regional areas and attracting and having the staff to provide those services. So it's certainly not a 5-minute fix, Sally, but it's something that's very much in the conversations and something that is certainly a work in progress. And I guess that's why I do what I do, is because it's just vital that we are looking at the gaps there. So
Excellent. All right, now Michael, you asked one about what is the wait time to access a level 2. So we're not going to talk about that today, only because we want to just do this in a very simplistic manner to begin with and follow the steps through. So Michael, there will be many more webinars to come, and that will be under the, if we look at the journey board, which if anyone wants a copy of this, they can find this on the OPAN website, and that's up at the moment. Thanks for that. The access, I think we'll probably talk about that in about webinar 3 or journey step 3, which could be webinars 6, 7, 8 down the track. So we'll give you a lot more information on that, Michael, and we'll keep you posted. So actually make sure you follow us as well so that you get the automatic updates that there's a new webinar coming as well. Okay, how are we doing for time? 5 more minutes. Okay, well we better get cracking on. So one of the other things that we need people, before they even access services, before they even pick up the phone, so this is what today is about, having that conversation, getting authority. What does that mean?
Okay, well, getting authority means if you don't feel that you're able to try and navigate this on your own, perhaps you might have a cognitive impairment, perhaps you can't use a computer, perhaps it's just all far too hard. You are nominating a person that can do that for you, that can have that permission. I can't ring up my aged care and ask about a client because it's privacy and confidentiality. So with the power of authority, certainly give my aged care a call. But if you get that set up and say you go into hospital or say your husband gets sick and you just can't cope and it's all overwhelming, but you need to talk to them, that you are enabling a person to do that for you. You've given them permission, and then my aged care can discuss where things are up to, which they normally can't without your permission.
Okay, lovely, thank you. Now, Sonia, I know that you're looking for an answer. So thank you for your question. For someone already providing aged care services, in terms of home care package, how would you go about customer engagement in order to improve? I'm not quite sure. Is it how do you go about customer engagement, or how do you improve the services being provided?
Yeah, and I guess Sally, that is a really good question. Sonia, that's a really good question, and I think it's really up to the organisation that you're working for and the management and what are their processes and their quality improvement, because that's a really big topic at the moment too.
Yeah, particularly with new aged care quality standards
out right now. It's all about how we're going to do it, and I think customer service is a really good and a big topic, and I think there's always room for improvement, but I think with the new Charter of Aged Care Rights, it's really going to come to light here.
High quality standard.
Yeah. Absolutely.
Yeah.
So, yeah.
And look, we know there are amazing people out there doing an amazing job in aged care, and I thank you all for it. We've both got 30 years in the industry, so we hear you. Right, beautiful. So other things about having that conversation. So again, this is just about, I guess, reflecting personally on how your aged care, if you're thinking you might need services soon, what does it look like? How does it feel to you? What do you think that you're going to need? And I guess what help is available. It may be just shopping. It could be, cooking, cleaning, transport. So what's transport about?
Well, transport could be taking yourself out for an outing or shopping. Mm-hmm. It could be going down the street to have a cup of coffee. It could be going to visit your sister that perhaps is in a residential care facility. Okay. And can be for medical appointments too, that if you can't drive.
Oh, good. So it covers quite a large amount. And again, like Ray was saying, how do we tell people that this is out there? They're probably struggling right now.
Oh, absolutely. And there are many out there. And I think if you know of any people out there in your communities, it's something that we all need to take responsibility for.
Yeah, that's so
Absolutely.
it. It's looking after your neighbour, looking after your community, isn't it?
Yeah.
And I think it's pivotal across Australia, not just in the remote and rural areas. I think Metro here as well. Don't you think, Tom? Looking after each other, community. Yeah, he gives the nod.
Yeah.
All right. So there's other things that may be, which I think is really important for people to know as well, is modifications to home. So what sort of modifications could one of the healthcare aged care packages provide?
Well, the modification could be simple as a ramp at the back of your home.
Yep.
When the stairs are just becoming too difficult, it can be a shower rail. It can be anything that enables you to stay at home and also be safe, to be safe at home, aids and equipment and so forth. And I guess another really good one too is social support. Is with social isolation, social support is another service.
So join a group.
Yes, it can be. It can be join a group. You might like to go to a social function. You can be accompanied to a social function. You might like someone just to play cards with you at home. So there, and also when people are coming in to do services, it is a social support. They're there having a conversation with you as well.
Okay, so I think we're running to time. Yeah. So we'll join you and leave you with the introduction to aged care services website information and dial-in information, and we'll speak to you again in half an hour. We love your questions. Keep them up. See you guys.
Thank you.